The White House is being sued. Texas asking a judge to block a rule that would require pharmacies to fill prescriptions for abortion pills. The guidance was issued to 60,000 pharmacies by the Department of Health and Human Services last July. The federal agency reminded retailers that if they refuse to prescribe the pills, they could be violating federal law. In the new lawsuit, Texas claims the Supreme Court's decision on Roe v. Wade shows that states can implement their own laws when it comes to abortions, and that the federal government does not have the right to intervene. But the abortion capital of the world is following the Biden administration's lead. Right now, there are 3 proposed bills that would further help the pro-abortion cause in New York. One of them requiring all state and city college campuses to offer the abortion pill at all student health centers. Another would make it possible to get the pills with just a telemedicine video call with a doctor. The final bill redefines a human embryo as tissue. Doing so, according to the New York State Catholic Conference, dehumanizes human life. Governor Kathy Hochul and other legislators are in support of these bills. Joining us now to talk more about the abortion pill is Joe Zalot, an ethicist with the National Catholic Bioethics Center. Hi, Joe.
Hi, Christine. Thanks for having me.
Of course. Now, Joe, access to the abortion pill is getting easier thanks to the moves we just mentioned in New York and at the federal level. Some people think the pill is a safer alternative to a surgical abortion. Is that true?
Well, in short, no. And I'm going to draw on some information that we have learned from the Charlotte Lozier Institute. We've done some interviews with them as well. And according to their statistics and their research, complications are actually 4 times higher with the abortion pill than they are with surgical abortion. In fact, in a study that they released in 2019, more than 20 women have died from taking the abortion pill. There have been 500 plus life-threatening complications, almost 2,000 severe complications reported. And so it's not safer. And some of the complications, very quickly, the big one is excessive bleeding. And if anyone has ever seen the Abby Johnson movie Unplanned, I've asked doctors whether the depiction of abortion, chemical abortion in that movie is correct and real, and they said yes. So certainly excessive bleeding. Also ectopic pregnancy rupture. Women don't know particularly if they haven't been examined by a physician in person, they could have an ectopic pregnancy, and the chemical abortion pill is going to do nothing for that, and that can rupture. And also infection, because oftentimes the abortion pill does not expel all of the fetal body parts, and that could be a source of infection as well. So the short answer is no.
Wow, it's really scary stuff. And as we just reported, New York Governor Kathy Hochul is proposing that state and city colleges be mandated to provide the pills to their students. Aside from the dangers you just described, why is making the pill available on college campuses a bad idea?
Well, I mean, I think it's a bad idea for a number of reasons, but I think it's important to point out that the reason they're doing it is that the abortion industry is trying to expand abortion in any way they can. So certainly problems would include, as we mentioned, the complications, but think about what it does. I mean, these chemical abortion pills, they normalize both non-marital sex, and they normalize abortion. They're trying to make it, young people are going to think, yeah, this is just something we do. It's a normal part of living. And lastly, we're talking about particularly, traditional college age women, 18 to 22, 23 years old. They're young, they're impressionable. Do they really know how the abortion pill works and how it will affect them? And there's real questions of informed consent. And I can tell you I taught on the undergraduate level for 12 years. And I can tell you that there are many, probably most undergraduate students, both male and female, who really don't understand how the reproductive systems work or how these chemical abortion pills will work.
Wow, not a lot of education out there. Lastly, the Biden administration has given the okay to pharmacies to dispense the pill, treating the drug like any other medication. What's the concern? Have you heard any pushback on that?
Yeah, quite a bit. And actually, the Biden administration is more than allowing it. It's actually pushing it. It's threatened to withhold Medicare and Medicaid funds from pharmacies that don't dispel these medications. And there has been pushback, thank goodness. There was a letter written by, I believe, 75 pro-life U.S. congressmen and congresswomen telling the Biden administration, no, this is wrong to do. I believe 20 attorneys generals have sent letters to CVS Pharmacy and Walgreens Pharmacy, the two big chains that have said that they are going to provide the abortion pills. We have a consultation line, and people have called us up and said, what can we do? And I've told them, I said, well, what you can do is just not go to CVS and Walgreens. And I've actually done that myself. I called up my insurance company and said I no longer want to get my prescriptions at CVS, and they said okay, and I changed to a supermarket pharmacy close to us.
All right, something we're going to be following. Joe Zalot, an ethicist with the National Catholic Bioethics Center. Thanks so much for being here.
Thanks for having me. Appreciate it.
Hi, I'm Christine Persichetti, anchor of Currents News. If you like what you saw, please hit the like button on this video. And if you want to see more content just like it, subscribe and click on the bell for notifications. Thanks for watching, because we are putting your faith in the news.